Good afternoon, everyone, and welcome to the first webinar in our series, Boost HPV Vaccination, a Quality Improvement webinar series. We're so glad that you've joined us today and to learn about strategies to improve HPV vaccination. I'm Catherine Flores, Executive Director for the California Immunization Coalition and a proud member of the steering committee for the California HPV Vaccination Roundtable. The mission of the roundtable is a coalition. We are a coalition of diverse stakeholders with a mission to work together to eliminate HPV cancers by increasing California's HPV vaccination rates. And I know many of you, all of you, share that goal of improving vaccination rates for HPV and other vaccines. The California HPV Vaccination Roundtable's goal is to have by 2035 at least 80% of 13-year-olds in California up to date on the HPV vaccine series. And we're going to work to do that by convening diverse stakeholders, executing high-impact initiatives requiring collaboration, disseminating evidence-based strategies and resources like today, fostering connections to help amplify the efforts of individual organizations. So a little housekeeping first. Today's webinar is being recorded and will be shared with you along with a PDF copy of the slides for our registrants and the attendees after the meeting. That'll be posted, the address to that will be posted after this meeting. And please use the Q&A to ask your questions so the panelists can respond directly to your questions. But for example, Dr. Wolynn will answer some questions online and other questions will be answered by myself or others. If you have questions after the webinar, please email us at the address below, info@thecaliforniahpvroundtable.org. So really happy to share that we have CMEs available for this webinar, and you will need to be logged into this webinar in order to receive CME. You must have signed into the webinar and complete the evaluation that will be posted in the chat at the end of this hour. And we will also email you a link following. So if you've registered, attended, you'll get make sure that you get an email with a link to the evaluation. But importantly, we want to make sure that if you're watching with a colleague or watching with a group, we want to make sure that you are signed in individually as you registered. So sign in on your phone or other device to make sure we know that you watched this and then took the evaluation, and then you'll receive your CME. So before we introduce Dr. Wolynn, our guest speaker, an expert on trusted messengers in health and vaccine communications, I want to talk a little bit about HPV vaccination, why it's important, and what the vaccination landscape looks like here in California. HPV is a very common virus, and exposure to HPV is expected, not rare. The U.S. sees about 14 million new infections annually. Roughly half occur in people 15 to 24 years of age, and about 90% of infections clear within 2 years. But those HPV infections that don't go away can persist and lead to disease, including cancer. And these cancers happen to nearly 38,000 Americans every year. This pyramid shows us which HPV cancers are the most common. Starting at the base of the pyramid, we see cancers of the oropharynx, or the mouth and throat, followed by cervix, anus, vulva, penis, and vagina. The burden is substantial and impacts both males and females. Cancers of the mouth and throat have surpassed cervical cancer in recent years to become the most common HPV attributable cancers, and that's why it is so important that we vaccinate all genders, because all are at risk for disease. This slide represents cancers in the United States, and so now let's look at just California. Over 3,000 people are diagnosed with HPV cancers in California each year. And on the corners of the slide, you can see images of people in California whose lives have been impacted by these cancers and have been able to tell their stories. Often they strike in the prime of life when people are busy raising their families and hard at work at their careers, building their lives. It impacts men, women, and the families of those diagnosed with these cancers. And these are those folks you see there, right there, and many more. These are testimonials of people who have survived, but only after undergoing intense, painful, and often lengthy treatments that have a lifelong impact. Not everyone survives, and even if you do survive, you know that there's traumatic and dramatic changes that occur in your life when you go through this. If you'd like more information on HPV cancer and vaccination rates, including the data by county, please reference the report linked below here. And again, when you have the slides, those will be available to you. So when given at recommended ages, HPV vaccine can prevent 92% of HPV cancers. If we vaccinated every youth California could go from seeing over 3,000 HPV cancers a year to less than 3,000. I mean, sorry, less than 300. Go from seeing 3,000 to 300. In California, we follow the AAP immunization schedule, which recommends the two-dose HPV vaccine series starting at age 9 for completion by age 13. And a three-dose series is recommended for those starting at age 15 plus or those who are immunocompromised. Along the bottom of the slide, you can see the incredible impact that vaccination against HPV is having here in the United States. In the first graph on the left, we see how cervical precancers have decreased by 80% in 20 to 24-year-old women. In the middle graph, cervical cancer in 21 to 24-year-olds also seeing the same dramatic downward trend. And in the chart on the right, genital warts, another disease caused by HPV, is also down in populations young enough to have benefited from the vaccine, as seen in the green and red lines. I think it's large enough you can see at least those lines, right? Older populations who did not have access to vaccination in their youth are not experiencing this same impact. So the goal is at least 80% coverage with HPV vaccine in our youth. And California vaccination coverage has improved significantly over the years, but is still below cancer prevention targets. With a 64% initiation rate and a 43% completion rate in 13-year-olds in California, we can see that on-time completion by age 13 remains suboptimal. And this means that many adolescents remain unvaccinated and therefore unprotected against HPV infection and possible cancer later in life. So throughout our Boost HPV vaccination series, we'll be helping you to overcome those major barriers to vaccination that happen at the level of parent and patient, clinician and staff, and health system. We know that vaccine hesitancy is a big and growing threat to optimal rates. And today we have Dr. Todd Wolynn to help address this barrier. Very grateful to have him here. Dr. Todd Wolynn is the executive director of the Trusted Messenger program, and he's a pediatrician with over 30 years of experience in primary care, vaccine research, and public health advocacy. He co-founded Kids Plus Pediatrics in 2010, serving as its CEO for 12 years, and led the practice to nationally recognized expertise in innovation, patient engagement, and clinical quality. Todd has most recently served as Vice President of Medical Affairs and Communication and Integration for Pediatric Associates family of companies. And many of you may remember meeting Dr. Wolynn in 2019 when he co-founded Shots Heard Round the World, a nonprofit dedicated to protecting the online safety of healthcare providers and practices. And for his pioneering work in healthcare innovation and science communication, Todd has been named as EY Healthcare Entrepreneur of the Year, a People Magazine National Vaccine Hero, and an AAP Holroyd Sherry Award winner. And he's definitely a hero for us in the world of vaccinations and communications. And so we welcome you, Dr. Wolynn. Thank you for being here.
Thank you. And double checking, you guys can see my full screen?
Yes.
Excellent. Well, thank you very much, Catherine, and huge thanks to California Immunization Coalition. I've had the great honor of speaking there before as the keynote, and also for the California HPV Roundtable, where I just recently spoke, I think, just a few months ago, back at the end of 2025. So I'm delighted to be able to present, and I'm going to be presenting some new information that's going to dig a little deeper into some of the communication work we do. But before we do that, I'd like to just go over some California-specific data. So this map is showing you the proportion of 13-year-olds who initiated the HPV vaccine series by county. And what we can see here is a range of as a high of 76%. The higher ranges are definitely in the more urban areas, with a low of 14%, tends to be more rural, more in the northern part of the state primarily. We have another slide here that looks at the completion rate. And again, definitely drop off from initiation to completion. But again, the lowest rates seem to be more in the rural, more toward northern, higher in the more urban areas as well. This slide shows the proportion of the 13-year-olds and who initiated and completed. So we can see this now over 2019, 2020, all the way through 2023. And we see, heading into the 2019 rates are good. And as we're getting at the beginning of the pandemic, rates are hitting a pretty good number. We see some of those initiation and completion rates, but of course, we take a little dip across the board at all metrics into 2021 as we advance through the pandemic. But the nice news is in your state, you're seeing some rebounding, which is really excellent. And you never really drop too far. Certainly, we've seen bigger hits elsewhere. So I'd actually say this is, I think, a reason to feel pretty good that you were able to maintain and bring back up to where you were, heading right in the back direction of where you were, which is great. This is another table to show a breakdown, 13-year-old by race and ethnicity. The lighter blue line is the initiation rate, so it's higher completion rate, and it just gives you a chance to compare different ethnicities and races as to these rates in relation to the HPV vaccine initiation and completion. And again, these slides will be shared with you. And then this slide is I think an important one to take home if you're looking at ages 9 through 14. Take home message here is that the earlier you start, you see a completion rate of 91%, but you see how that drops. Like at 12, it's 63%
Do
happens.
that. We'll do
But
that.
again, this slide's again showing by age. The top set of years, the top set of lines by year looks at initiation rate. The bottom set of lines is completion rate. Again, 13 to 17. So looking at California Immunization Registry data compared to the NIS data. And again, these numbers will be shared or slides will be shared so you can review this further. So let's go to the next slide. Okay. So again, Trusted Messenger Program Executive Director is my current role, which is a nonprofit effort that empowers healthcare professionals to drive healthcare quality outcomes with evidence-based communication. If you say that another way, it's about empowering healthcare providers to better engage, connect, and support their patients and their families, right, through all the noise and the grifts and the distractions with evidence-based communication. I would tell you, this is a huge tool that we don't use, nor have we been trained in the kind of communication we need to, given the environment that we're in 2026. Okay, so this is what we're hearing based on interviews we're doing around the country, right? Every visit's taking longer, more questions. Even families I've seen for years are asking me a lot more questions, let alone families of newborns or new families coming into the practice where it's just lots of angst, lots of questions, a lot of it, of course, being driven by all that noise. And what I'd like to tell audiences, particularly of a variety of healthcare professionals, is the science has never been better, right? More diagnostics, more therapeutics than we've ever had. But we are failing at the communication of that science. This is some of that information I was sharing about our practice in Pittsburgh, where we competed with two large billion-dollar integrated delivery networks. They're very smart, very good people, but we continue to be top across all quality metrics. A lot of that was driven with communication. So like I said, number one in HPV vaccination, but also in other vaccinations, as well as well visits, preventative visits, and screenings. Using communication both internally in our practice and externally in a way that I will tell you I did not learn in medical school, nor residency, nor anywhere on my medical professional path until I went and got separate communication training, which ended up serving us well. And if you know the story of our practice, which we don't have a lot of time to talk about, but Catherine mentioned, we ended up forming a nonprofit to really promote science online, particularly on social media. So trust is a key factor to recognize who possesses trust. Healthcare professionals are still really recognized as a top trusted field. Across all other categories, healthcare is at the top. Nurses are actually almost always number one. If you look at the field of pediatrics, it goes pretty high. But pharmacy, really midwives, NPs, PAs, all of these providers, public health professionals who I know can get beat up a lot, but even down to the level of the communities you serve, as long as there's a local relationship there, there's a lot of trust. And I think, don't recognize how much trust we have. Now, trust is dropping in other areas. The joke here is like media, Sith Lord, and yes, member of Congress, really low trust right now. So we have to recognize the trust that we possess. But the sad thing is, right, we squander it. And when I talk trust of healthcare professionals, it's with a capital H. So it's really any people that directly impact and connect with patients who have their ear and they want their guidance. Again, we squander because we aren't trusted. We aren't trained. I'm sorry, we're trusted, but we aren't trained in communication. And so, when people are impacted by inaccurate information, we're not usually sure how to handle it. Sometimes in advance, we assume that this is going to be a difficult conversation. And so we may water down recommendations. We're seeing that happen around the United States. So I'm here to tell you how we can engage and connect and communicate powerfully without abandoning the science and really help support our families. So yes, healthcare professionals, the trust does not reside really with the health system or even the hospital. They may have been a more revered kind of community fixture, but nowadays big healthcare, industrial healthcare complex is kind of getting lumped in as, oh yeah, pharma and insurers and big health systems, they don't have our interests. And that's the reality. There's a big attack trying to erode trust with healthcare in general, but the level of the local professional, the healthcare professional who connects with patients, really a lot of trust there. So that's the relationship we have to first recognize and fortify and nourish and grow. Now, this is just more data. This is older data already, 2024, but we have 2025 and 2026 data showing trust in my healthcare provider. My practice, local, relationship has gone up, and it continues to show very strong ratings in 25 and 26. But it's not guaranteed, nor is it indefinite. And so this is not like a given. I don't think we can continue to just assume that we'll continue to be trusted because there's absolutely targeted efforts right now to erode trust between patients and families and even communities and their local healthcare providers. There's absolute, inaccurate information being pushed about, in terms of vaccination. Oh, yeah, they do it just to make profit. Well, if anybody knows the world of vaccinations and at the office level or the clinic level, they are not big money makers. They are huge cost to manage effectively. And hopefully you should be able to generate profit on any service you give. But I know several practices that lose money doing so. But that's just one example of an effort to try and erode trust. So what I'm trying to say is we don't have like 5 or 10 years to get this right. You see what's happened in just the last decade in terms of communication and trust and attacks on health and science. We don't have 5 years to get this right. We need to get this right like now. It's one of the reasons our Trusted Messenger program is not only doing trainings around the country, but we're now training trainers to really elevate the gap that we're missing, which is the use of strategic communication to help guide our patients and our families, like I said, through the noise toward evidence-based recommendations. Now, you can rarely get anybody on different sides of the political spectrum to agree on anything. But here, look at this recent data. And this has, again, been shown to be true even in 2026. This is, I think, 2025 data, which is who do you trust to tell the truth about medical issues and protect public health? Look at that, left, center, right. In 80%, right, are my doctor or my practice, right? Local, relationship. I can't say that enough to you guys. So the trust resides here, where we directly serve and engage and connect with patients and families. But we take this trust and we squander it, not because we want to, but because none of our training, not as nurses, not as pharmacists, not as medical assistants, not as public health professionals, maybe a little more in public health than healthcare, do we get really good, actionable communication strategy. If I asked you guys, if I was in a lecture hall with you, and we've spoken to 11,000 people in the first 12 months, either online or in person, all live though. And when we ask, like, do you have any communication training? Most say no. Occasionally they'll say, well, like a mock patient, or sometimes people throw motivational interviewing out there. And my response to that is, how's it going for you? I know we all take motivational interviewing classes or courses, and that's like check the box. I did something that's communication related. How are you employing that in day-to-day practice? Does it make a difference? I really want to know the answer to that. Maybe that can come up during Q&A. Because what I'm going to tell you is I'm going to teach you a methodology that you will learn while we're talking today. It will be usable the next day and practicable every day after that. And it works. So I would love to see what you think. So good communication is essential to good healthcare. But again, we have not been taught this information. Now, increased acceptance of our recommendations is built on trust, absolutely, but it requires optimized communication, both when we're face-to-face in the exam room, in the clinic, in the line of the pharmacy. It also includes online, using digital sources, including social media. That's not today's talk, though. It also includes things like SMS campaigns and emails, also not today's talk. We're going to talk more about face-to-face connections. If you've never seen this slide, this talks about when we invest in certain areas of healthcare, what impact does it have on health outcomes? You know, the fanciest MRI, PET scanners, genetic therapies, robotic surgeries, 10% outcome, like very small. If we address social determinants like housing, food, economic stability, safety, transportation, and environmental issues, 20%. Genetics, you say, well, you know, like what can you do with genetics? You're born with the genes you got. So you say 40%. This is the deal. Behavior change is huge, right? Behavior change is huge. If we can get people to have safer sex, not vapor jeweled, put a seatbelt on, put sunscreen on, don't get bad sunburns, we can have a huge impact on health outcomes just by impacting behavior. That includes vaccinations or immunizations as well. And if you believe in the field of epigenetics, what happens to those genes that we have in terms of what proteins they create, those that turn into disease or not, is also shaped by the environment and the behavioral choices we make or behaviors we have. So you can actually impact epigenetics with behavior change. So we have a really significant impact if we can impact people's behavior. Guess how we do that? We build it on trust. We optimize communication. You can change behavior, and that changes the quality of life and the quality of care we deliver. So when I tell healthcare providers, and certainly in public health, they get this, like this is our job. How do you get people to do more of some of these or less of some of these? And of course, immunizations or vaccinations is a huge, huge step. And we can see what happens at a national level when inaccurate information starts creeping into people's mindset about is it safe? We take diseases that were really well controlled, say like measles, say like mumps, say like Haemophilus influenza right now, which is starting to pop up again. When you just start to reduce community immunity because enough people are like, I don't know what to do anymore about immunizations. I don't know, what to believe, but they still know who to believe. Are we going to be able to meet them there in a powerful way? That's what we're here to talk about. Okay, these companies get it, right? These companies do not have the innate trust or inherent trust that we do. But what they do know is the communication is incredibly powerful. They know how to use these kind of things to reach people where they're at and get you to buy a $12 double pump mocha latte, right? Or a streaming service or a car. Holy heck, right? They get it. They do it to the tune of hundreds of billions of dollars that they spend per year, and they realize a positive ROI, which is a positive return on investment, meaning for every dollar spent, they get more than $1 back in products or services being sold. And we are not hucking tires or insurance or coffee. We are trying to keep people healthy. We are trying to keep people immunized and protected against really bad diseases like HPV. This is like a no-brainer. You heard Catherine say we could reduce cervical cancers by 92%. For Christ's sake, we're here in Australia talking about eliminating cervical disease as a cancer from like a continent. That's pretty powerful stuff, but they're really good at immunizing. It's mandated. It's for boys and girls. So we can do better. And again, we are the only sector in the US economy and the largest sector of the US economy that isn't using communication powerfully this way. It's kind of like this side thought. It's like, here's how we, listen to the heart and here's how we do an MRI scan. And it's kind of like this communication is an afterthought for us, which is insane. So more to follow. So yes, I want people to start thinking how communications drives clinical and operational success. And we want to think about how we engage our patients, our families, and our community. But guess what? You got to get your house in order first. So you need to make sure, what's the culture of communication in your own setting? As I told you at Kids Plus Pediatrics when I was the CEO there, we wove communication best practices internally and externally. We made sure that everybody was on the same page. We made sure that we were all rowing in the same direction or singing from the same song sheet. Because if you're not, anybody can just destroy any initiative. And I actually learned this, we didn't talk in the beginning, but I was a lactation consultant for 25 years. We opened up a regional breastfeeding center and we had Sally checking in people in the front and we had people that would come and say, we're here for our breastfeeding visit. And Sally, literally, real story, changed the name, would say things like, oh, you know what? My kid got so sick, it had to be readmitted for dehydration when I tried to breastfeed. Why don't you just give a bottle? You can see what's in there. Get some formula. It worked great for us. Guess how those breastfeeding visits went. Not so good, right? And it wasn't until we heard this and then had to sit Sally down and explain, let me go through the benefits and risks of breastfeeding and how we mitigate risks and how we follow closely with families and realize like, holy heck, we didn't have our house in order. Imagine Joey down here who's rooming the next patient and the next patient's here and they're talking about, hey, we're here for our adolescent vaccines for Susie. And Joey goes, oh, wow. Okay. I mean, that's all right. I know school, they need that TDAP and meningitis, but I don't know, the HPV, I saw something on LinkedIn, my cousin just posted, or not LinkedIn, on TikTok. They posted, and boy, that didn't sound so, like Joey could be sinking the initiative. So make sure, and we have strategies around this through the Trusted Messenger program, how we can survey our staff, how we can address our staff before we do any initiative, or if we're in the midst of the initiative, to make sure that all the staff and any new staff that come on board understand how to be part of the team. Is everybody going to be the same level of awesome advocate? No, but nobody should be sinking or cutting your legs out from you on an initiative. And if you aren't really paying attention and doing good internal communication, that totally can happen. Okay, so I told you there's lots of different approaches to the most powerful are face-to-face and digital. Today we are going to focus on face-to-face. So I'm going to take you through communication around this aspect of when you're with families and patients. So to be clear, vaccine acceptance is along a continuum. It's not like you just stop at the accept and you go right to the refuse, right? It's this kind of weaving back and forth, right? There are still a large percentage of people when they're given a clear, concise recommendation that will go ahead and say, yeah, go ahead and do it, right? Think about like, the older sibling already went through these vaccines last year. You come in and you say, here's the vaccines to do today. And they're like, yeah, you already did it for his brother. Like, go ahead and do it. Or they just trust you and you say, this is what I really recommend. They're like, yeah, go for it. And then there's certainly 2, 3, 4% that are like, I don't want any vaccines. That's probably, less than 5%. But there is a large swath in the middle that have questions and concerns. Notice I'm not even using the word hesitant anymore. There's certain words that I will tell you through communication best practices that we're finding are beneficial or harmful. And I will tell you, nobody wants to be labeled a hesitant, right? And also by just doing so and saying they're hesitant, it's kind of like they don't trust you, doc. And that's not the case. They just have questions and concerns. Certainly, if you're closer to the red side where the arrow is, you may have a lot more questions and concerns. Or if you're closer to the green, you may have not many at all. But I will tell you that it's important to recognize that people are constantly, depending on what they're being exposed to, in the midst of kind of going up or down. And unfortunately, because we're exposed to so much social media with so much inaccurate information, people are constantly being impacted to kind of shift, which is what we've seen in the country. The rates across the country are decreasing, but we as healthcare professionals can make a difference. We just need to be trained. So we have data showing that vaccine communication actually can be ineffective and backfire by itself. So here's one where they talked about, and I have docs, especially like the older docs, like bring back the pictures of like, really scary stuff and intubations and ICUs and bad rashes. And here's a study that showed that, for about measles, showing that the photos made, in this case, they used the word hesitant, so this is what the study said. Hesitant parents are more aware of the dangers of measles, but decrease the intention to vaccinate. And there's a study looking at flus. Just because you have facts put out on flu, it might have dispelled some of the myths around flu, but also decrease the intention to vaccinate. Again, communication on facts itself aren't enough to change behavior. And we'll talk more. So these are the kind of things we're up against, right? Vaccine acceptance is really complex. It's not just about facts. Look at those things on here about emotions and thoughts and viewpoints and social norms, really important one. What do you think everybody else is doing? Your morals, your identity, values, all that stuff. Emotions, particularly, fear being the strongest. So thoughts are in there too, but you'll see like it's multidimensional, multifaceted as to how we make decisions, particularly in terms of vaccine acceptance. Now, here's training I wish I had had as a medical student, as a resident, as a young professional. I think nurses, nursing students, pharmacy student, public health, I think we all should be getting this. How do people make decisions, right? We are absolutely all about going to the head. Here's data, here's repeated studies, here's the reproducibility. And frankly, that's not how we make decisions. It's how we feel, right? We all know this. I knew last, 2 or 3 nights ago, I'm sitting there, I'm doom scrolling on my phone. It was like 10:30, it was 11:30, and I'm like, oh my God, I was like, I should go to bed. I really should get a lot of sleep. And instead, it's kind of like, dopamine and scrolling, and oh, wow, there's a cool gardening video because I like gardening. Whatever, right? we know that we shouldn't eat that fourth donut, but God, I love Krispy Kreme and I'm so hungry today and I eat that, but I know better, right? So feelings drive our choices as well. So let's not be hypocritical. I won't be hypocritical myself. But our training fails us, right? Because when we realize somebody is like, hey, you really should get this flu vaccine, and they're like, I don't know, I'm scared. I heard it can cause the flu. And we go right to like, well, let me show you this great study. Or if it's a pediatric patient, we had like 280 pediatric deaths last year. It was like the most in like, almost over a decade. Like I show them data or studies, or I try and even worse, like scare them with that data or show them scary pictures. That actually makes people who are already a little reticent and a little resistant to the recommendation you're making more dug in. We have data to show that. So you don't go right to data. You don't try and scare people because you can't scare the fear out of somebody, or you can't scare somebody out of being scared. The key here, and there was a guy like 2,000 years ago named Aristotle who kind of figured this out and talked about like the three paths to persuasion. And he talked about pathos. Pathos is how we feel. It's our values, our beliefs, our emotions. Again, fear being the strongest. And he said that this has the strongest impact on how we make our choices. He also talked about ethos, which is reputation and what people think about us. But we just said healthcare professionals are trusted. We have immense data showing that's still the case, particularly down at the local level, at the practice level, even at the practitioner level. That's key. That does not hold up for, some CMO, chief medical officer coming on and talking to 10,000 or 100,000 patients. It has to be like, oh, there's Joe, my nurse practitioner, or there's Dr. Sally. That's the level that we have real ethos. So if we can recognize that reaching people down here, and I'm going to teach you how to access this because we really should. Again, every other sector of the economy and entity does it. And again, we're not hucking tires or insurance. We're trying to keep people healthy. So if we can learn how to reach people and how they feel, and we already have ethos, eventually we can get the logos. That's above the head. That's how we think. That's logic. But the problem is if you lead with logic, we lose. It's why some 20-something out in the middle of the country on his or her TikTok channel can convince people to eat like horse antiparasitic medication rather than the best possible therapeutic to prevent that particular disease because they're a hell of a lot better communicator than you or I. They may not have inherent trust, but they have strategies around that as well. But our inherent trust, we squander. That sucks. So let's get better. So here we go, right? The missing critical tool that we need or that we should be bringing in is communication. Imagine, I say to healthcare professionals, imagine going into the room and the patient hasn't been weighed or gotten a blood pressure yet. We'd be like, I can't imagine that, right? When I talk to medical assistants and nurses and nurse assistants, they're like, I'd have to run out and go get the cuff and do it or weigh them again. Because I remember walking into an exam room sometimes without my stethoscope or otoscope, and I'd say, excuse me, I'll be right back. Like, I can't do the visit without these tools. And yet we walk in all the time without good, appropriate communication training, right? Because, oh, you're smart, you're healthcare professionals, you've gone through MA training or nursing school, or you went through medical school, you just keep communicating. But we weren't taught, strategic communications. As a matter of fact, I just told you our training fails us. This has to be recognized. It still hasn't. And I remember a day where it was ludicrous to think about bringing a computer into an exam room. I mean, I'm not so old that, we didn't start having smaller computers, but just the idea of dragging in a computer, which of course got even smaller, it took a long time for that to become like the norm. But yet we aren't bringing communication, strategic communication into the exam room with us, which is perhaps the most powerful tool that, by the way, can be used in every visit. Otoscopes only are needed for certain diagnoses, same as stethoscopes. But good communication is not only used in every inpatient encounter, it's used on your portals, it's used in your EMRs, it's used in your emails and SMS campaigns. So I'm just saying, we are missing the most powerful tool there is to help people, which is communication. Now, I'm going to tell you, communication is bioactive, and you're going to be like, hey, what's he talking about? I'm going to tell you a little bit more, and it changes behavior. And you've already seen that, and we've talked about that in a previous slide. Think about this statement. What we say to our patients matters. How we say it matters more. Think about your best healthcare experiences as a patient or a family member of a patient, and think about your worst ones. I guarantee you a lot of them were about how we were made to feel. I was disregarded, I wasn't listened to, I was rushed, or, oh my gosh, they listened to me, they really heard me, they really helped address my concerns or answer my questions, right? How we felt. Think about it, think about it, think about it. Okay, wow, we got to keep on time here. Okay, let's get you through the communication methodology. It's called AIMS. Announce, inquire, mirror, and secure. This is what we're talking about today. So I'm going to take you through this training because it's all about relational, deep relational interactions. And we have to understand first rule of communication, who's your audience? So we need to understand that. And we need to understand how we talk and what we say. And I'm going to just pick this up a little bit. So here's that gradient again we showed over refusing to accepting and recognizing. This is a original study called theoretical model, but stages of change that basically go through pre-contemplation. I'm not ready, to contemplation. I'm thinking about it, to preparation. I might start. Action, you've definitely started. Maintenance, it's been going on for 6 months. You go through these steps, and you can go the other way too. And I don't have time to go into stories, but people can slide the other way, which is why multiple points of contact and communication are important, because you don't see patients every day, right? Or you don't see the same patient every day. So we have to engage them in other ways to make sure that they're not just hearing from the webosphere and social media all the time. That's not our social media. So recognize there's stages that we go through and change, and how can we help them to get through these stages to follow evidence-based recommendations. So think about this, right? We're shifting from the orange to the blue, right? Orange is kind of old school healthcare. This is a case. I'm here to gather information. I'm going to give you information, to be much more conversational rather than didactic. I have a person, a real live person in front of me. I'm going to demonstrate active listening. I'm going to have a personal discussion. I'm going to, tap into emotions and maybe share some of my own in a professional way. And again, having bi-directional communication and recognizing verbal and nonverbal communication is very important. So let's dive in a little deeper. So when we announce, right, it's clear, it's concise, it's called a presumptive recommendation. A ton of data and studies were done around presumptive recommendations. Noel Brewer's done a lot, lots of other people. That's really going to be key with the announce. The inquire is a sincere effort to understand. Mirroring is part of the active listening. We're going to repeat and confirm we're understanding the person correctly. And securing the relationship. Matter of fact, AIMS is not about making people accept your recommendation. Take that. AIMS is about building trust, even when you don't agree. I make a recommendation, you don't accept it, but we leave with me feeling like, hey, I didn't abdicate the science, and the person felt like, hey, I felt heard. I'm just not ready to make that decision. But they're moving through the stages. We're happy to and ready to have another discussion because I built trust. So it's not about forcing or coercing people. It's about building trust. So let's go through it. Again, we're going to go through these steps again. So we're going to announce the vaccination. If questions arise, that's fine. We're finding that healthcare providers are now kind of getting a little anxious because they feel, and healthcare professionals are feeling anxious when they get questions because they're like, oh, is this going to go south? I'm giving you a strategy that you can go into every recommendation. Again, not banning the science. Respect the patient. And like I said, leave with more trust without feeling like, oh my gosh, this is going to go south. I don't have any strategy. I'm going to grit my teeth. That stuff's going away. So you're going to really, truly, sincerely try and understand what the person's concern is if they don't immediately accept the announcement that you've just made. And we're going to show that we listen by mirroring, as I said, and we can even express empathy. I'm going to talk to you how we can do that. And the key here is always securing the relationship, building trust, building trust, building trust. So even if the recommendation is refused. All right, ready? So let's dig into the announce piece. You're going to make a presumptive announcement. You're going to start with a statement, not a conversation. So, Joey did great. First 2-month exam, he's here. Let's get all those vaccines. Here's the vaccines he's recommended to get today. Or for Mrs. Jones, hey, Sally's due for her TDAP or HPV and meningitis vaccines today. Let's get those done. Right? Boom. Declarative, presumptive announcement. Assume acceptance. If they don't accept, that's okay. But I'm not sitting here and saying, are you okay? Do you want the vaccines? Are you, maybe not? I mean, I oftentimes liken this to saying, hey, Joey's 2-month visit was great. It looks great. Do you want to put him in the rear seat, facing rear, secured in a car seat, or maybe up front on the front seat with you, or maybe on the hood of your car? Like, I don't want to make you feel bad. Like, hell no, we wouldn't do that. The data's clear. That kid is safest facing rear in a car seat, appropriately restrained till age 2, right? We wouldn't abandon the science there. Why would we abandon it here? And it's because healthcare professionals feel antsy and they're worried about a fight. We're very conflict averse. So we kind of start backpedaling or watering our recommendation down. So key to remember is presumptive announcements, all you need in many cases. But if the person isn't immediately accepting your recommendation, or if they express concerns or questions, you go to inquire. The second part of announcement here is if questions arise, remember it's normal. It's normal to want to ask questions about things that might go into your body or your kid's body. And so when a patient doesn't accept your recommendation, also recognize they might be on the defensive now because you recommended, let's get the TDAP, HPV, and meningitis. And they're like, I don't know about that. Maybe not exactly everything you're saying. And here's the case, right? I'm not sure I want to get all this today, or maybe let's just go with the TDAP and meningitis for Sally. I'm not sure I want the HPV. Recognize, right? They're feeling kind of vulnerable because now they've told you they don't want to do what you just said. So they may be rearing up for a fight, right? Everybody could be getting defensive here. How do we get past that? How do we actually access pathos and emotion? So we're going to talk about that here. Okay, so this is an inquire. We're here to understand their concerns. So your goal is truly to understand, right? You're not trying to like, okay, I'm going to listen to you and then I'm going to pounce on you and tell you why you're wrong. I really want to know what's concerning you. Open-ended, judgment-free, something like, can you tell me a little bit more about what your concerns are? Mrs. Jones, what's worrying you about the HPV vaccine? Where'd you hear about it? I really would like to know more. Sincere. We have data showing we interrupt our patients oftentimes in 11 to 20 seconds. So listen, you want to take your time. Don't interrupt, even if they're misinformed, even if you're short on time. This does not take a half hour or 60 minutes, but those extra couple minutes are going to be really important here. And again, beware of body language. If you're rushed or if you're crossing your arms or you're rolling your eyes or you're humping, that is nonverbal cues that will be picked up and you will lose trust immediately. Now, you're going to mirror and you're going to confirm that, you're going to show that you've been listening, that you understand by repeating what they've said. So things like, so I want to make sure I get this straight. You saw on TikTok, but like too many vaccines can overwhelm your baby's immune system, right? Is that right? Or you've heard that the HPV vaccine might actually cause infertility. Do I have that right? You're confirming, right? You're mirroring back. It's part of active listening. I want you to know now that I know what's scaring you. Is that right? So now they may be bracing, right? For the lecture, for the fear, for the facts, for the judgment. And here's where, hey, guess what? We can express empathy. Boy, if I thought that HPV vaccination could cause infertility, that'd scare the heck out of me. I could understand why you want more information or why you were really thinking about maybe holding off on this. By showing empathy, a lot of people say, oh my gosh, don't magnify the myth, don't repeat the myth. But in this case, you're not really in any way validating the myth. You're validating the myth is scary. That would scare me. My goodness, right? See, different. You're accessing pathos, not in a nefarious way. You're actually just empathizing with your patients. That's why we went into healthcare or public health, is because we really get like how scary being sick is or could be becoming sick is. That's part of what we do. Now, remember when I said you could get defensive, right? Both the healthcare professionals, but also the patients can get defensive. If I think I'm going to get judged or I didn't immediately accept your recommendation, I'm kind of in this reactive mode. Think about the autonomic nervous system, right? About sympathetic and parasympathetic. Think about like sympathetic fight or flight. Like I'm closed, I'm defensive, I'm ready to fly out of there or fight you if you're giving me something that I don't want. And imagine this, receptive. How do I get people to be open? Parasympathetic. Like this is where we're kind of I'm ready to take in new information or I'm ready to digest food, right? It's like all that stuff. How do you get people to move from there to there? That's the bioactivity of communication. You literally not only can access pathos, but you can actually help physiologically get people from this state of reactive, like, I don't want to listen to anything you have to say, to, hey, I'm okay, I'll hear more. Like, I trust you. And now I'm not feeling beat up or bullied or pressured or lectured. Yeah, tell me more. Okay, so when we look at securing the relationship, this is really about people listening to you and feeling that you're not there to lecture them. And asking permission is a really good way to do this. So now, after you've found out what might be scary to them, you can say, would it be okay if I shared with you why I gave these vaccines to my own kids? Right? And also be genuine and authentic. Of course, if you don't have kids, don't tell them that you gave these vaccines to your own kids, but why you recommended it to your nephew, your niece, your next door neighbor, whatever, right? But making it personal, using anecdote and story can make a really powerful point. My wife and I felt a huge relief once our kids turned 2 months. We were that excited to get our kids' vaccination started. So, and again, with HPV vaccination, I oftentimes told people why it was so important for us to get our 3 kids vaccinated with HPV vaccination or with the HPV vaccine. So again, this process sets the stage. I have 2 other slides around secure. So you are going to respond to specific concerns with evidence-based information. People want facts, but they also want to be reassured, and they also want to have that trusted relationship with you. And so this is where facts alone aren't going to do it, but all the things we've just discussed will make a difference. Again, this is talking about the parent who thinks everything can be can all the vaccines at once can overwhelm their immune system. And this is where you're telling them, look, here's the data is that a baby's immune system can handle thousands. I think it's like 10,000 antigens at once. Baby's going to be getting a tiny fraction. That's like 160, 180 antigens, but they are going to be protected against 8 serious diseases. Like, so what's in it for them about this too? So that's a really important point to make. What's the benefit, right? The HPV vaccine's been rigorously tested, monitored, for over multiple years now. Started in 2006. It offers tremendous protection from HPV cancers. There's no evidence at all of any infertility, right? But so you're reassuring them. And then keep the response brief, positive phrasing. Certainly cover things like redness, swelling, common side effects. Definitely can have some discomfort. Very reasonable. And they're going to get the vaccine information sheet or at least be offered it as well. So all things to recognize. So we're building trust again. After you respond to their concerns, they may go ahead and decide to vaccinate. So they're like, hey, thanks for letting me understand how you feel. Let's go ahead and vaccinate Joey right now. Or they may not be ready, and that's not ideal, but it's okay. How you respond is critical to building trust for subsequent visits. So you still thank them. You still secure the relationship. You say, I really appreciate you sharing your perspective, and you're also letting me share with you as well. So here's an example of how to say that. And again, securing isn't about getting to yes, it's about strengthening that relationship and building trust for subsequent visits too. This is just quick data or quick strategies around, you never just repeat the myth because if you just do that, you could say, and don't forget, vaccines don't even cause autism. You can actually instill that. Wait a second, my doctor said something about vaccines and autism, or, saying, oh yeah, there's no risk, which is never true. There's risk to water and bananas. So you don't really say that because then it leaves the person saying, wait a second, what about risk? This gives you some of the values, right? Purity culture, like I only want things that are natural and kind of crunchy and all that. And so you can actually respond to somebody who's coming from that angle of a purity culture, talking about how the vaccines work with our natural immune system, right? And in this case, as liberty, I don't like people telling me what to do. But in this case, if they're not trusting the government or health system, you say, look, I believe vaccine's important. It's why I get it for my own kids. I would never recommend something for you or your kids that I wouldn't do for my own family. True, 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 right? Authentic and build on relationship. So again, this is just looking at, I know we're running low on time, so the key aspects to AIMS and the active listening, responding, and providing trusted links. Sometimes people say, I really am on Instagram, and we've talked to, and we're building out, like here's 5 content creators we really trust. And you give them a QR code, they can even scan it and say, oh, right, okay, so you can transfer your trust. So if they are on that platform, at least, and if you're not on there already making content, which you should be, or at least your practice should be, if possible, but you can give them other people you trust, so you can transfer your trust too. And keep the interactions brief and unemotional. If you feel like you're becoming a punching bag or they're really getting revved up, of course you're not there to be a punching bag. You can say, I think we need to end this. Again, these are just aspects of AIMS we've talked about. It's evidence-based. Again, it's active listening. It's all about building trust. And it can be quickly learned. Like you just got it explained to you right now. You could literally start using it. Yes, it gets better with practice. And yes, we do real trainings. This is a very abbreviated version of one. Here's a quick recommendation of the vaccine. Parent says, I'd like to hold off. You go to inquire. I understand you'd rather hold off, but can you tell me what might be worrying you? I just prefer to hold off on like the flu vaccine right now. And I say, okay, I get it. But can you tell me a little bit more? And they say, well, my daughter sent me a Facebook post that tells them making people sick. You go to Mirror. You say, so let me make sure it was your daughter sent you a Facebook post telling you the flu is actually causing people to get sick. Did I get that right? And they say, yeah, that's right. And it's actually being all covered up is what they said in the video. And here I can show some empathy. My goodness, if I thought that was true, that'd be scaring me, right? And then you can go into things like the secure, which is, can I tell you why I'm recommending this vaccine for you? And they say, sure. And I tell them about the flu and why I recommend it. I tell them that I got it from my parents and my grandma. And in this case, they said, yeah. The idea here is that you're going through all these aspects that we just talked about, right? So that, I want to make sure I'm leaving, so we have at least 7 or 8 minutes here. That's us. There's actually a free hour of CME in that upper right hand. If you go to our website, it's there too. And this talks about AIMS and presumptive recommendation, about healthcare professionals as trusted messengers, as well as how to answer any question. I do have this, thank you very much for your time. I have QR code. We have a LinkedIn page where you can find more information about us. That's that QR code to give me feedback on today's quick abbreviated training as well. And then I know we're going to unshare my page in a second. So if you can quickly scan that and let us know what you thought about my training, that'd be great. But I am open to taking questions. I'm going to 10, 9, 8. I'm going to shut my sharing off. 7, 6, 5. Quick snap and give us some feedback. 4, 3, 2, 1. Thank you.
Excellent. Thank you so much, Dr. Wolynn. You always um, so enthusiastic, and I feel your energy. Always
Thanks.
get us to a place where we want to just get out there and do it right. So thank you again. And thanks to everybody who's asked some questions. We're going to have a little bit of time here. We'll do some rapid questions and then wrap it up for the day, and love to have you back again another time. One of the things so many questions. One of the things you talked about was around, I wonder if you could expand on, trusting my doctor. I trust my doctor, but it's those other doctors and it's the system. Do you want to expand anything on that?
Yeah.
Because I think
So,
that too a little bit in, personally
ab-
times.
yeah, absolutely. So, what I would say about that is that the trust is local to, I think, at least the level of the practice. And healthcare providers still in general. Like again, when you talk about just trusted professions, I think that's still true across the board, including local public health. I think has a little bit of a benefit that I know public health's getting beat up, but that's part of where I talk about trust being transferable. So if somebody in my practice works with me, in our practice, we made sure that all of our voices got a chance to be represented, whether we were writing content for our website or doing things on a live show or doing some stuff on social media. I don't think we elevate our voices in the way we can, but most importantly is our face-to-face person voice for that precious time we have in the exam room or in the clinic or in the pharmacy line. And that's really what this training is all about. And my goodness, I've never traveled so much in my whole life. This is something that I think is finally being recognized of how important it is. And again, I would challenge any of you guys, like, let me know if you've had other training that you find really powerful to navigate through these situations. But AIM seems to really be ringing a bell with people.
Yeah, good, good. Another question is around what you said about the term hesitant and people
Yes.
not wanting
So
to
I
be.
use the words questioning concerns, right? This is a person with questions, concerns. I don't label them and call them hesitant. And again, I don't call it hesitancy because I think that's emotionally charged. By the way, there's more communication research. I don't use the word mis and disinformation anymore because those words now are being shown to trigger about a third to a half of the population that you're on one side of the spectrum and you're here to kind of push your values on me. So I say inaccurate information, false narratives. By the way, I don't say vaccines are safe and effective anymore because we have data to show that that's triggering for people. Are you saying it's always safe? You just said it's safe and effective, but water and bananas aren't safe and effective all the time. So I say this is the best possible way for you to be protected against this particular disease with this particular immunization. Totally defendable. You can stand by that.
Right. And like you said earlier about people remembering certain things, it's like if you say, well, nothing's 100% safe, well, that's what they're going to focus on, right? Oh, nothing's safe.
Right, right. And I
Oh,
see Marcia said, how do you respond to the family who, when asked what they heard or what are their concerns, declines to answer? I have so many who just shrug and just don't want to even have a discussion. I hear you. There are definitely some people that are so guarded that they don't even want to have the discussion, right? They feel there's an adversarial kind of situation or they're just, but here's the deal. You do not go into your primary care provider's office and disrobe and talk about your most personal things if there is not some modicum of trust. You do not undress your baby and hand your baby for somebody to walk out of the door and down the hall and weigh them and measure them. Like you trust them enough to be in that space. So using stuff like using the methodology around AIMS may not get you all the way to accept, but it can say you can follow it up and say, I get it. I understand this sounds like it's a really sensitive subject. I just care so much for your child and your family. It would help me a lot just to better understand. I'm not here to push anything on you. I just want to hear. Like, and if somebody heard that, like, you're not going to push it on me, and you stand by those words, right? And you just say, I want to understand, and then you can inquire, you can mirror back, and then you can say, that's why, I'm recommending because I'm so passionate. But if you're not there today, just thanks for explaining for me. That makes me feel like I understand better. Thank you so much. Holy crap. Now they're like, oh, you didn't railroad with me. You didn't beat me up. You didn't judge me. And maybe you didn't even get to the really strong recommendation, but you just said, well, this is why I would recommend it. But now they're to a point like, you didn't beat me up. I can have another conversation with you that's further up that decision tree or, the choice tree because you've brought them from pre-contemplation up to like thinking about it now.
amazing. That's great. Great advice. We need to wrap up, and I want to see if you
Yeah.
have any last thoughts. And I know we started with talking about how important it is to start young with our healthcare providers in training. Any last thoughts
Yes.
on that you'd like to share?
We are working hard to get to medical schools, nursing schools, PA schools, midwife schools, nurse practitioner schools, all and public health schools. Like I am lecturing and presenting in all those areas. And curriculum change is super hard. Don't get me started. We are still doing curriculum like it's 1950s, when in fact we have these things in our hands that can really help us learn, sort through the minutia that we get packed into our heads in all professional schools. But we sure as hell aren't taught how to communicate. You aren't going to pop in here and say, hey, help me talk to this patient better. But I can tell you what a pheochromocytoma is, which is a neuroendocrine tumor with an incidence of like 2 to 8 per million. So yes, we need to do this at every step. Students, residents and training programs, and the professionals that are already in place, we need to help them too. It's better training, resources, and support.
Yeah, perfect. We're so grateful to have you here today and welcome anytime. Thank you.
Thank you
Thanks
so
for all the
much.
great questions from everybody. And as a reminder, to receive continuing medical education credit for this webinar, you need to have signed in, complete the evaluation, get that in. If you have any questions, the info number that we have in the slide that you'll get after this call. Let's see, we'll email you a link. And thank you for joining us all today. We hope you'll join us for the next webinar in our Boost HPV vaccination series about using the announcement approach for HPV vaccine with our guest speaker, Irene Landaw. And that'll be on Wednesday, May 13th at noon again. And if you haven't already registered, you could have registered for one, two, or three. I hope you do register for all three on the link that we showed in the code. And lastly, I want to thank the California HPV Roundtable team for coordinating, sponsoring this event. Dr. Wolynn, especially, for your great resources and ideas. The AAP Orange County for providing the CMEs, and to my wonderful colleague Cameron Lawton here at CIC for making all this possible here. And we look forward to joining you again. Thank you again, Dr. Wolynn, and
Thank you very, my honor. Thank you all.
take care.
Bye bye.